Okay.
Welcome to Montgomery Heart and Wellness here on YouTube as we get ready for the premiere of a brand new series called Clinical Rounds. Hi, I am the weight loss champion Chuck Carroll, joined by Dr. Baxter Montgomery. Dr. Montgomery, I am so excited about this new series because it really does give the viewer the opportunity to walk with a patient start to finish on their medical journey. And I got the opportunity to screen the first two episodes, and man, I am riveted. So I am so thrilled that you are here with us today.
I'm glad to be here. Thanks for having me.
So when I watched these episodes, I just kept thinking to myself, man, this is really like putting the pieces together kind of a medical mystery and figuring out not necessarily the diagnosis, but the best course of treatment. Before we get into the substance here, how difficult is it as a doctor to figure out just the right course of treatment? Because there are a lot of different options and opinions out there.
That's a great question because, treatment can be very tricky, largely because, as you said, there are a lot of options and a lot of directions one can take. However, when someone has an illness as complex as cancer or heart disease or diabetes, or in many cases in which we're faced with, individuals come in with a number of different health conditions. So, for example, they may have heart failure and also kidney failure. And so some of the medications that we use to treat the heart failure will have an adverse effect on the kidney. From the standpoint of treatment, sometimes diagnostic tests are needed to help with creating a treatment plan. Someone who may come in with acute shortness of breath and a rapid heart rate, you may be concerned of them having a blood clot to the lung. However, you may want to order a CT scan to evaluate that, but they have kidney dysfunction, which may preclude, your ability to do that. So there are a number of things that you have to deal with in terms of treatment. A lot of it deals with determining whether the therapeutic or diagnostic tools, and you have to think about the patient's condition. So it's a complex set of things that you have to evaluate. Treatment decision is part and parcel, a cascade of decisions that the treating physician or practitioner has to consider.
All right, and let's get into the nuts and bolts of the first episodes here. Part one premieres this Wednesday, and part two then on Friday. So if you haven't already subscribed to the channel, go ahead and do that and make sure that you get your notifications. So as soon as those videos go live, you will be the first one to see them. The patient that we will be following here in this initial series has been diagnosed with cancer. And one of the things that the viewers will hear from you time and again throughout these first two episodes is that the body has a natural ability to heal itself. Does that hold true as well when it comes to a disease like cancer?
Absolutely. And I share with all my patients that the cure to your ailment, the primary solution to your ailment is going to lie within. Yes, there are a lot of things we can do to help you out. Yes, sometimes, if someone has a broken bone with a displaced bone, surgery may be needed to, replace the bone and set it. Surgery may be needed for certain other things. Sometimes medication on a limited base may be needed for other types of ailments, etc. Nutrition obviously is there, but the body ultimately has to heal itself. And so the focal point of treatment, regardless of whatever other therapies needed, whether someone needs surgery or not, whether someone needs, medication A or B or some chemotherapeutic agent, regardless of whether those things may be needed, the core treatment has to be some treatment that's going to enhance the body's ability to heal itself. In the case of cancer, you want to enhance the immune system to help the body fight cancer. So we give three key elements that go into that was key, and nutrition, of course, is one of those. So it's really important to focus on nourishing the body and enhancing the body's ability to heal itself. And once you do that, that's the foundation of recovering from any illness, regardless of what other therapy is needed.
Yeah, and that's a really interesting point that you just made because you're talking about the immune system. And I think that the average person, when they hear, well, strengthen the immune system, they're trying to prevent catching a cold or get over the flu faster, our ordinary illnesses. I'll phrase them that way. But the immune system, as you just said, this fascinates me, is also responsible for these diseases like cancer. So I mean, is it as simple to say, when you think about the immune system, if you just eat a bunch of oranges and you get a ton of vitamin C, you're going to be able to cure your cancer? Is it really that simple? Can you break it down for us?
Yeah, yes. I mean, the immune system's really, we use that phrase immune system as though it's this one isolated system. And really the body has multiple systems within the cardiovascular system, the gastrointestinal system, the skin and system, and mucous membranes and the like. The immune system is really part and parcel to all of those other systems. So when you think of the body's circulatory system, we think of the heart and the arteries, the veins, but then there's lymphatics that go into that. And then how the circulatory system interact with the GI system. And so when you think of the immune system, it's a system that we think, okay, you have white blood cells and lymphocytes and the like, but it's much more complex than that. Yes, you have lymph nodes, but that immune system interacts with other systems, such as the gastrointestinal system. The gastrointestinal system has a microbiome, which enhances the immune system. The liver, for example, makes antibodies and other proteins and enzymes that's needed for the immune system. So the immune system is, yes, a system of inflammatory cells or immune cells that identify foreign agents or foreign entities that may have entered the body or that's existing in the body. So that foreign entity could be a virus, it could be a bacteria, or it could be a cancer cell. So it could be a native cell that's gone awry, that's changed, and now it's become something that's foreign to the body. So that's the one aspect of the immune system, but the immune system is encompassed by other aspects, such as the gastrointestinal, such as the renal system, and all these systems come together to enhance the body's ability to fight something like a cold or a bacterial infection or, yes, even cancer.
If you have a question for Dr. Montgomery, go ahead and post it in the comments or in the chat. We'll go ahead and get to those in just a little bit. In the episode here, the patient talks about almost having a greater fear of going on these immunotherapies compared to the cancer itself, which I thought was really also very interesting because I would think that the cancer diagnosis was everything. And so many people would just be like, I don't care what it takes. Just go ahead and do it. And let's get rid of this beast that is cancer. But this guy took a step back and he came to you after he hit that pause button because he wanted to really explore what his other options are. So when somebody is diagnosed with cancer, and their oncologist tells them that, this immunotherapy is the best course of treatment. What exactly is that, and what kind of side effects could the patient be in store for?
Well, there are a variety of therapies for cancers, and it depends on the type of cancer they're being treated. Oftentimes, individuals get a combination of, say, radiation therapy or surgery and chemotherapy afterwards. And so there's a wide variety of therapeutic agents, and they probably change, by the minute. There are lots of research protocols out there, and so there's a broad, difference. And this particular patient had three choices of immunotherapies, really, sort of one immunotherapy at three different levels of doses or intensities. And he was particularly concerned about the risk-benefit ratio. And the interesting thing is that he presented to us. I mean, we're a cardiovascular practice, although we practice integrative regenerative medicine, and that's why lots of people come to see us, because he was looking for a different approach, something to improve his overall health. And I think he had the right attitude in seeking that approach first. What I'll say to the general public, anyone who's trying to make this decision, first and foremost, you want to get as much information from your oncologist as possible. Have them share the medical literature with you. Have them share the risks and benefits. And if possible, even talk to someone else who's gone through the therapy, if that's a practical thing. So you want to get as much information about the therapy that you can. I mean, over the nearly 30 years I've been in private practice, I've sat across the table from many patients recommending different therapeutic procedures and medications. And it's, incumbent upon me to inform them as much as possible as to what the benefits and potential risks of these therapies are. And the patient has to then take that information and make a decision. And it's important for you as a patient to take control. Get as much information as you can. Don't try to jump to a decision. If you're uncomfortable with the decision, take your time. If someone's trying to rush you to make a decision, then you need to take pause, even get a second opinion. So it's always important to get as much information about the therapy as you can. And then the other thing I'll tell the audience is that you should always, always, take the step of improving your health, regardless of whether you have to go to surgery the next day or the next week or the next year. Start doing things to improve your health. And oftentimes we see patients who come to us, who are sent to us by other physicians to get cardiac clearance for a procedure or medication. And, we will often start them on a nutritional detox and in preparation for the procedure they're getting, because you have to understand that the medical procedure itself, whether it's a medication such as chemotherapy, in this case immunotherapy, or a surgical procedure, the medical intervention itself brings about some level of insult to the body. So not only you have to have the body healthy enough to tolerate the primary ailment, in this case cancer, but you have to get the body healthy enough to tolerate the therapy for the primary illness, whether it's chemotherapy or surgery or the like. So this is something that's very, very important that people should understand. Every situation requires that you get the body healthy, regardless of the amount of time you have. And the body can start to turn around, start to improve its biochemical and physiological status within hours, days to weeks. So this is never too late to get started.
And let's explore this a little bit more, because the prescription that you guys talk about on episode 1 of Clinical Rounds, which premieres Wednesday right here. So again, if you haven't already, go ahead and subscribe to the channel, hit that notification button as well. The prescription that you dole out is kind of threefold. It is for hydration, it is for rest, and it is for exercise. Is it possible to rate the three in terms of importance, or is it one of those things where they all get an equal slice of the pie because they all work in conjunction with each other?
Yeah, so the big areas that we cover, first and foremost, optimal nutrition. So and our definition of optimal nutrition is a minimally processed plant-based diet. And optimal nutrition starts with what you remove from the diet. So it's not optimal until you remove all forms of processed foods, all forms of animal products, all forms of saturated fats, all forms of processed sugars, and as people refer to as frankenfoods. So those things have to be totally eliminated. And then you have to replace it with fresh, natural plant foods. It could be lots of greens. It could be cold pressed juices. It could be smoothies with super greens. So you want to have superfoods in your system, fresh fruits that are hydrating. And so optimal nutrition is first and foremost. The next thing is the three areas you cover in terms of exercise, rest. I sort of put all those together as a package. So to the extent that you are able to sleep better and you start eating better, you're able to sleep better. Many people have sleeping problems, start to sleep better once they're eating better. But you want to start sleeping better, hydrating yourself, and exercise, moving your body, stretching, those types of things, if you're able to. Sometimes people are not able to do that. That's why we put the nutrition first. And then the third area we have is try to eliminate either prescription medication or over-the-counter medications. You want to minimize other medications that you're taking as much as possible, as soon as possible. And that's kind of a unique recommendation that we have compared to other doctors, even in the regenerative care or plant-based community. We are really, really big on minimizing medications. If you're going to put, one chemical in to treat a certain ailment, i.e., chemotherapy, you want to have fewer other drugs because these chemotherapeutic agents can have an adverse impact on the liver. It's going to have an adverse impact on the kidney or the GI tract or some other organ. So if you have other medication that are being cleared by the liver, other medication being cleared by the kidneys, that's yet another insult that's added to those organs that's going to make things worse. So you want to try to minimize as many other medications you're taking, including over-the-counter acetaminophen or any drug like that.
Yeah, I was just going to ask you if that included all of the medications that are so widely prescribed, for high blood pressure, high cholesterol, a lot of people now on antidepressants. So you're saying all of those need to be factored in here?
Yes, they have to be factored in. And when I say minimize or eliminate, obviously this has to be done responsibly. Obviously, you have to talk to your doctor and share with them that, hey, I'm going through this other treatment for chemo or the medications that can be removed or reduce the dose, et cetera. And that's part and parcel of what we do in our center when patients come from different parts of the country, parts of the world, and they're facing these illnesses. One of the major things we do is work on detoxing the body, cleansing their system, and minimizing these medications. And you notice once you nurse the body properly, the blood pressure is more easily controlled, the cholesterol is more easily controlled, you're sleeping better, you're less anxious, et cetera, et cetera. So optimal nutrition starts to undergird the overall health of the body in many different ways so that these other medications, which are primarily treating symptoms anyway, become less needed.
All right, now let's go back to nutrition here for a second, because as you know, in this country and actually globally, the standard diet not exactly optimal, I would think, in terms of the course of, or in terms of helping the body enhance its ability to heal itself. Case in point, you have about 3/4 of the people here in the U.S. who are overweight. More than 44%, I believe, are obese. We are very much accustomed to eating that standard American diet full of highly processed, high fat, high salt, high sugar foods that are really driving up all of these chronic diseases. By and large, do you think that as if we were able to curb the obesity trend through nutrition, we would also then start to see the rates of these cancers, specifically the ones that we're talking about here in clinical rounds, also then start to go in a much healthier direction as well?
Yeah, I think you're correct. And the way I like to think about it is that if we curtail the poor, healthy lifestyle trends, then all the other trends will go in the right direction. So, for example, if we get into a standard of people routinely nourishing their bodies optimally, not just going on a fad diet and having cheat days. No, your lifestyle must be optimal nutrition all the time, and you should be working your way up to eating at a higher level of a more nourishing level, not just eating something healthy every now and then and having a cheat day we eat fried this or grilled that or whatever. So it needs to be a lifestyle and attitude change. There needs to be a lifestyle of moving, exercising, and doing these things outdoors, getting out into nature on a regular basis. These things need to become part and parcel to the routines of our lives, and they need to be factored in our lives. We need to be intentional about this process of working these healthy lifestyles, proper hydration, proper sleep, relationships, getting, crazy things out of line. So all of these things should be part and parcel of, a day-to-day, week-to-week, month-to-month, year-to-year process of making ourselves better. Optimal health is a journey, and you're getting better and better. So like a career path, if you will. Someone starts off with a career path in high school, they go to college and they study, get a higher level, and they get more advanced in their career. Well, your optimal health should be a career path that you take toward getting yourself to more superlative levels of optimal living. And if you do that, then these other things go away naturally. Your bodies go to natural body weight. So then obesity is not an issue because people are not sick because they're fat. They're fat because they're sick. So I don't isolate overweight and obesity as to say, oh, let's target that. I isolate poor nutrition, poor health, lifestyle, and let's focus on that, because then the weight loss will occur, the diabetes correction will occur, the hearts will get stronger, the cancer will be suppressed. And so these are things that you can expect once you prioritize optimal nutrition and optimal living.
All right, we have time for a few more questions here. Again, episode 1 for Clinical Rounds premieres this Wednesday, and then part 2 very shortly thereafter on Friday right here. So make sure that you subscribe and get that notification so you can be among the first to watch it. One of the things also that will be discussed in this series is with this particular patient, it's very interesting how he had these little nodules in his lungs. And I will preface this question by saying I'm sure that this is going to vary from patient to patient. But if somebody were to employ all of these steps that you were talking about, the proper nutrition, the hydration, the rest, the exercise, all of that, really start living a much healthier lifestyle. One, is it plausible to expect that in some cases these nodules can resolve on their own? And two, is it even fair to ask how quickly that might occur?
Again, cancer is one of those things that can be fairly tricky, and some cancers are more aggressive than others and the like. What I can say is the following. Whether the nodule represents spread of the cancer, sometimes they have lymph nodes that enlarge, that represents your body's immune system revving up to fight the cancer. And these are some of the things that you often see not only in cancer, but also in infection. If you have, a spread of infection, you get nodules on the lung from the spread of infection. So any kind of illness that has a systemic effect, on the body can cause, immunological changes or inflammatory changes throughout the body. So yes, if you properly nourish the body just starts to correct it. It starts to create an environment the less conducive for the cancer to spread. So then what happens is that when the body starts to become alkalinized, better hydrated, the liver's functioning better, you're making antibodies more effectively, then the body's able to fight the cancer and ward it off, and the cancer can theoretically go under retreat. And we've seen there are countless cases, people we've had on our show who have been diagnosed with advanced cancer, and they go on an aggressive lifestyle intervention, nutritional detox, and the like. And many individuals who avoid undergoing surgery, chemotherapy, go through the whole process, and the cancer totally recedes. So we've seen many cases of this. So it's something that, whether you decide to get surgery or chemotherapy or not, I don't think is the absolute important thing at the beginning of your diagnosis. But what you need to do, whether you make that decision to have the chemo or not, or whether you make that decision to have the surgery or not, you must absolutely make the decision to optimize your body, and therefore you start by optimizing your nutrition.
Yeah, and making that decision is not always the easy one, because as people will see in clinical rounds, there's sometimes, one doctor will have one opinion, another doctor will have another, and then of course it is up to the patient to make the ultimate call. I mean, and you use the term soul searching with this particular patient in terms of figuring out what it is he was going to do. I mean, how can you help the patient feel comfortable about making what has to be a very educated but nonetheless difficult decision?
I've dealt with patients in this situation for many years, in many situations in the cardiovascular space. And, we deal with patients with, aggressive heart failure, which is, by far more, the number one killer. I mean, heart disease kills more people than cancer. And oftentimes I'm making a recommendation of, hey, a defibrillator, you could benefit from a defibrillator. Now, I tend not to tell the patient, you need this or you need that. What I share with the patient is, hey, you can benefit from this, and here's what the science shows us, and here's how you might benefit. So it's a matter of them benefiting. Now, every benefit, there can be a risk associated with that benefit. So we examine both aspects of that. And then the patient has to realize, okay, how is that going to affect my quality of life? What are the other risks, and what are the things I'm going to have to go through? So all of those things have to be examined, and the patient knows best. They know best, what they're dealing with in terms of different aspects of their life. And we as the physicians or consultants, we'll recommend something based on, one data set, but the patient has other data sets. So if you're the patient, you have to realize, well, look, I'm not just basing this on the medical literature. And oftentimes the medical literature is done in a context where you have a certain group of people with a certain clinical profile, and you may not exactly fit that clinical profile of that population. So that's one aspect of it. And then there are other aspects. Your life is such that maybe your job or your career won't allow that. So you have to weigh those things in, and those things are also important. Even when you're dealing with something that's life-threatening, as heart disease or cancer. So you have to weigh all these factors in, and take your time. If you're not comfortable moving forward with something, then don't move forward with something. I tell my patients oftentimes, don't just do something, stand there and make your mind up, weigh the facts, come back, ask more questions. And I've dealt with patients who, would benefit from pacemakers or defibrillators. They'll take months or years even to make a decision. So oftentimes these issues are not as critical. Now, what I do tell them to do is that what you have to do, what I strongly recommend you do right now, is start improving your health through optimal nutrition and optimal lifestyle. That's something you do like at the snap of a finger. So even while you're trying to make that decision, so well, do I get this surgery or not, you can make an immediate action in terms of changing your lifestyle while you're trying to make that decision in terms of which direction to go.
We have a few people who are watching right now, Dr. Montgomery, who are curious about the ozone treatments that you talk about, EBO2. I believe that's one and the same.
Yeah.
Who talk about in clinical rounds and previously here on the channel. Are there any side effects that come with that? And for those who aren't familiar with that ozone treatment yet, can you tell us a little bit about that as well?
Sure. And one thing I want to say about clinical rounds in general, and a great thing about the show, and I would encourage everybody to watch, not only this series, which is going to be great, but all clinical rounds, because we go into in-depth details about not just the nutrition. One thing to say, okay, nutrition, but we talk about exactly how it works in that condition, but how we use it to integrate with other therapies, ozone therapy, phosphatidylcholine infusion, poly MVA, and chelation. And so there are a lot of different integrative regenerative therapies that are beneficial. Ozone therapy ozone is O3, it's a gas. And what we do, the way it's applied, an IV is started. Now, the different approaches ozone, we use intravenous ozone. Ozone can be done through nasal infusion through oil. It's not directly inhaled, but through an oil concoction. Some people do rectal ozone, some people do inject ozone to the joints. But the most effective way of using ozone is using it intravenously. And the way it's done is if it's like a regular or high dose ozone, we'll extract a certain amount of blood from the vein into a sterile bag, and then we'll infuse ozone into that. And the ozone gets in, mixes with the blood, and creates liposomes through the fat, and also activates immune cells. Then it's reinfused. We typically run it through a UV light, which can kill microbes. So if someone has, bacteria or viruses in the blood, some people have lots of mold exposure. It can actually deactivate and kill these microorganisms. So it's a cleansing effect and a filtering effect that can happen with the blood also. But what happens with ozone, I like to use it, to use the analogy of a recharge, if you will, and the other agents that we use to help recharge the cells. But ozone creates an oxidative stress in the mitochondria. And when it creates an oxidative stress in the mitochondria level, it causes a rebound antioxidant response. So it's recharging the cell system, improving mitochondrial function in every cell. So every cell, the mitochondria is like, it can be thought of as the battery. And it makes ATP. It carries out a lot of other important biochemical reactions. So if you have progressive illness, typically people get chronically ill due to mitochondrial dysfunction. And so we have the dysfunctional mitochondria not producing ATP effectively. There's a condition known as oxidative phosphorylation. So for every breath of air I take, every amount of unit of oxygen I take in, I get a certain number of ATP. So maybe 2 molecules of oxygen will give me say 37 ATP molecules. However, if my mitochondria becomes weak and dysfunctional, that same amount of oxygen may only give me, say, 17 units of ATP, maybe 14 or 10. And so I'll have to, take in more oxygen to get a certain amount of ATP. So you have to breathe twice or three times as hard or fast to get the same amount of energy production at the cellular level. So what ozone does, it enhances mitochondrial function. So mitochondria makes ATP more efficiently. Certain things like nitric oxide is produced, but that's good for cardiovascular disease. The immune system is modulated. I use the word modulated, meaning that if immune system is revved up, i.e. autoimmune system with arthritis and inflammatory conditions, then it's toned down. If the immune system is suppressed, then it's amplified. And so a modulated immune system is optimized, put in attention, and made able to fight off infections, cancers, and the like. So it enhances the body at the cellular level, and it's one of the foundational therapies we use along with oxygen, along with nutrition, to help patients with a variety of chronic illnesses.
All right, let's kind of wrap everything up today. This has just been fascinating, and I'm really so excited for everybody to be able to see the first two episodes of Clinical Rounds this week. Again, episode 1, the premiere is this Wednesday, and then Friday right there, part 2. But let's go ahead and just
I think part 2 is on Saturday, if I remember.
Saturday.
Saturday, yeah. Wednesday and Saturday. Yeah.
It's worth the wait, Dr. Montgomery. That's all I'm trying to say here is it's worth the wait, but you won't have to wait long. But let's just kind of take everything home and recap what it is we were talking about. Right there in the title of the video, it says 3 key steps for getting from and making progress over a cancer diagnosis. So what, Dr. Montgomery, would you say are your 3 key steps?
Well, essentially, you want to optimize the nutrition. Okay, that's going to enhance the body's ability to heal itself, whatever that chronic illness is. If it's cancer, it may be the case of fighting a cancer, heart disease, physiologically and biochemically, the body starts to correct itself, or diabetes, arthritis, inflammatory conditions. And again, optimal nutrition starts with removal of toxic foods, sometimes fasting, prolong your fasting window. It's going to be something that's going to enhance your overall nutritional status and your biochemical status. The next step is a cluster of things: proper rest, moving the body, fresh air, sunshine, hydration. That's a cluster of things we add in that part 2, because these things are very, very important. Hydration, of course. Many people are sick because they're thirsty more so than ever, and I mean that literally. Volume depletion is something that impairs your circulation, impairs your body ability to move toxins out of the body. And so hydration, optimizing the hydration of the system. And then the third part is going to be, and this is a fairly unique recommendation that we have at Montgomery Heart and Wellness compared to other places, is to remove other offending agents. Now, those other offending agents are oftentimes prescription drugs. They're oftentimes over-the-counter medications that we take. But then what I failed to mention earlier, you also want to remove things like alcoholic beverages, as well as smoking and things like that. That's more on the nutritional side. So essentially, other prescription drugs, you want to talk to your doc, say, can we reduce the dose? Can we remove this? Can we take this away? Can we eliminate some over-the-counter medication? And even supplements. Many people are taking so many supplements that they get over-the-counter, mail in. And sometimes, we will just remove all the supplements and start from scratch and start supplements on a targeted basis. So anything that's going in your system that can have a potential adverse effect or stress on the liver, stress on the kidney, stress on the gastrointestinal tract, stress on the cardiovascular system, these things need to be minimized as much as you can, as fast as you can.
All right, Dr. Montgomery, thank you so much. And listen, if you guys have enjoyed the video today, you're fired up for Clinical Rounds, go ahead and give this video a thumbs up as well. And again, one more time, don't forget to subscribe and hit that notification button as well so that you know the minute that the very first episode premieres on Wednesday, you can go and check out Clinical Rounds episode number 1. Dr. Montgomery, this has been a real treat. Thank you so very much for your time, and congratulations on the new show.
Well, thank you very much. And we really look forward to sharing the stories and giving people an insight in terms of what we do and how it's done, and I like to say an insight into the new way of practicing medicine.
I like it. The new way. It's kind of the old way when you think about it, right? You kind of put your body first and you just focus on that proper nutrition, you know? It's
That's
funny
right.
what
That's
these
right.
it's funny what these last 100 years have kind of done to our perspective on things, isn't it?
You're right. It's the new, but yeah, it's the revitalizing the old way of doing it, which is the proper way of doing it.
There you go. Dr. Montgomery, thank you, my friend.
Thank you very much.